Hello, I'm Jessica Buzlog, and I'm doing intramuscular injection skill today. First, I'm going to check my order in the MAR. I'm going to verify my order in the MAR. I'm going to verify the 6 rights of medication administration, making sure I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. I'm going to check my, verify my dosage calculations, and the doctor ordered 6 milligrams of morphine today. I checked this in the MAR. It is supplied in 4 milligrams per 1 ml. So I need to withdraw 1.5 or 1.5 mLs to get my 6 milligrams of morphine. I'm going to gather my supplies and go into the patient's room. I'm going to do hand hygiene. I closed the door behind me for patient privacy before I wash my hands. I'm going to check the patient's wristband for 2 identifiers. I'm going to verify their date of birth and their name. I'm going to introduce myself. Hi, my name is Jessica. I'm your nurse today. Do you have any allergies, either food or environmental allergies? No? Okay. So your doctor ordered morphine today. The reason for morphine is for moderate to severe pain. It treats the pain. It basically interrupts your the pathway from your pain receptors in your brain. Some of the side effects are nausea, vomiting, and constipation. There are severe adverse effects, and we need to know about these right away. It would be dizziness, lightheadedness, low blood pressure, low heart rate, or low respiratory rate. So let us know right away if you experience any of that. Also, some patients have advised us of burning or stinging upon administration of this medication. Do you have any questions? No? Okay. I'm going to do hand hygiene again and put on my clean gloves. I've gathered my supplies. In my supplies, I have a vial of morphine. I did verify this in the MAR. I have a syringe that is 3 mLs. I'm gonna get rid of the wrapper into the dispose of that. I have a 22 gauge 1-inch needle that's separate and capped. So I need to attach these on, or this on here, okay? I'm gonna set this down. I do have an alcohol swab. I'm gonna discard that too. I need to clean the top of my vial with alcohol swab. Prep pad. I'm going to discard that, and I'm going to let that air dry. I'm not going to fan or blow on the vial. I'm going to take my syringe, and I'm going to, with the cap on, I'm going to withdraw 1.5 or 1.5 mLs of air. I'm going to remove my cap. I'm going to inject the air into my vial. 1.5 mLs of air. I'm going to pick up my vial and I'm going to withdraw 1.5 or 1.5 mLs of morphine into my syringe. I'm going to tap my syringe for any air or air bubbles. I don't see any. I'm going to set my vial back down, pull out my syringe. I'm going to verify my correct dose is 1.5 mLs of morphine. They're in my syringe. I'm checking that in the MAR. And then I'm going to make sure you can see. One and a half mLs in the syringe. I'm going to do the scoop method and recap my syringe. I'm going to label this with the medication and dose. I did it away from my patient. Next, we're going to check the site of the injection. We're going to do a ventrogluteal site. So the patient needs to lie lateral or supine. I'm going to take the heel of my hand on the greater trochanter. I have a hard time with that one. I'm going to have my wrist along the femur and my thumb pointed towards the groin. My fingers are going to spread. And my injection site would be between my index and my middle finger. Before I do that though, I'm going to inspect the site. I'm going to make sure there's muscle definition and integrity and size. I'm going to make sure there's no edema or tenderness when I palpate. There's no masses, and I'm going to ask and make sure that there's no indication that injection has been done here recently. Okay. I'm going to take an alcohol prep pad again, and we're going to clean the site. We're going to go from inside to outside, about a 5 centimeter diameter. I'm going to toss that. This also needs to air dry. We will not be blowing or fanning it with our hand. It just air dries. Okay, I'm going to put the end of my, I'm sorry, I don't remember anatomically. This end of my hand here for some traction, my thumb towards the groin for the Z-track hold, and I'm going to hold taut here. I've got my medication. I'm removing the cap. I'm coming in at a 90-degree angle. I'm going to inject very slowly, about 10 seconds per ml. Once all of the medication has been injected, I'm going to wait 10 more seconds before removing my needle. Okay, I'm going to release the needle and the hold. I'm going to engage the safety mechanism on my needle. If I have that, I'm going to put it in the sharps container. I'm going to put some clean gauze on my injection site. I'm going to have some light pressure, but not rubbing or massaging the area. Okay, I'm going to remove this. I'm going to bandage the site if necessary. I'm going to discard of all of my supplies. I'm going to remove my gloves and discard of those. And I'm going to do hand hygiene. And I'm going to document my procedure.